This is a Chapter 4 review on the muscular system. And as we go through, as with every chapter, we start by looking at the different combining forms for the areas that we're going to be talking about. So specifically for Chapter 4, the muscular system, it's going to be the combining forms for muscles, the fascia, and the tendons. The function of the muscular system is to actually hold our body erect and make movement possible. Without those muscles, we couldn't do very much. Generating body heat through some of the muscles that we'll be talking about, and actually helps move the food through the digestive system, assists with blood flow, and helps move the fluids through the ducts and the tubes associated with other body systems. The different structures or organs in the muscular system. This was a real issue with the last chapter. So please make sure, even though we're talking about the digestive system and the circulatory system and the lymph system, they are not part of the muscular system. Okay, the muscles in those systems are what we're talking about. So when I ask you for the organs or body parts of the muscular system, I want you to be able to tell me muscles, there's fibers, there's fascia, and tendons. That's what the different organs of the muscular system consist of. So you're going to see a number of different muscles that are here. Again, this is not anatomy class. I am not going to ask you about all these great muscles. You will get to there eventually. There are muscle fibers. And again, if you remember back to the second part of the med term book, second chapter, we talked about cells going to tissues, going to organs, going to body systems. So we have a number of different types of muscle cells that are going to make up muscle tissue. And there's different types of tissue. And so the fascia is the first that we're going to be talking about. And this is a band of connective tissue that either separates or binds together different types of muscles or groups of muscles. So when we look at the term myofascial, we're going to start at the end just like we do, and then we're going to go to the beginning of the word and read across. So we would define myofascial as pertaining to the muscles and the fibers and the fascia. Tendons are actually narrow bands of fibrous tissue, and they attach the muscles to the bone. And so you can see here in the picture that there's the tendons and there's the muscles, and you can see how those tendons attach the bone to the muscle. There's different types of muscle tissue. The first type of muscle tissue is skeletal muscle. This is voluntary muscle. When we look at it under a microscope, it's striated. This is what helps make our body move. So these are muscles that we say, okay, move my leg, and we voluntarily move them. We think about it, and then it happens. When we look at the smooth muscle or involuntary muscles, that's different. That's the type of tissue that's actually lining our internal organs, like the digestive tract and our blood vessels and our lymph vessels. When we look at the digestive system, we have something called peristalsis, and it's the constant movement of those muscles that are moving the food through the digestive system. We don't have control over that. It's just automatically happening. And so it's very important that we know that and recognize the difference between voluntary muscle and smooth muscle. We also know smooth muscle to be called visceral muscles as well. And the last type of muscle tissue is myocardial muscle. And this is going to be the muscle tissue that's in the heart. Myocardial means pertaining to the muscle in the heart. We have a lot of different types of parts of the heart that we'll be talking about when we get into the cardiovascular system. But this again is involuntary. Our heart beats without us thinking about it. So the cardiac muscle is also involuntary. We talk a little bit about the antagonistic muscle pairing. So as we tighten a muscle, or contract the muscle, it actually causes the muscle to become shorter and it gets thicker. When we relax the muscle or move our arm out, it returns to the original form and the muscle is longer and thinner. What we have to remember, the muscles work in pairs. So as one of our sets of muscles are contracting, the other set of muscles are relaxing. So that allows our arms to move. That allows our legs to move. Some of the terminology that we've heard already, this is kind of a review from chapter 2. Abduction. So when ab means away from, so when we move the limb away from the midpoint of the body, that's called abduction. Now, the easiest way I remember this is if you look at the suffix or the prefix AB. If you look at the round part of the letter B, it actually goes away from the letter A. And that's how I remember the difference between ad and ab, because ab is away from. If you look at the letter D, the round part is towards the letter A. So when we look at the adduction, it means that it's moving toward. So again, little hint to help you remind you of how you can remember the difference between ab and ad. And this is a nice graphic of abduction and adduction. Abduction is going to be moving away from the body, bringing our arm up, and adduction will be bringing the arm back down to the midline of the body. We also have flexion and extension. Extension is going to be decreasing the angle between two bones. Extension is increasing the angle between two bones. So if we extend our arm, we're increasing the angle between those two bones. If we flex and make a muscle, we're actually decreasing the angle between those bones. And again, a nice visual representation. So there's a lot of different terminology that you're going to hear when we talk about muscle motion. We have hyperextension, and that's when we overextend our limb to beyond the normal point. There are people that are able to do that. Contortionists are able to do that. Elevation is going to be raising or lifting a body part. Depression is lowering the body part. Rotation is actually a circular movement around the axis, where circumduction is actually a circular motion at the far end of the limb. And I think this picture will help you. So as we look here, this is rotation where the axis is. Circumduction is here out at the outside. We also have terms like supination and pronation. And I remember this as supination is rotating the arm so the palm of the hand is up. So you could hold soup in it. So if you rotate the arm up, so your palm is up, you can hold soup in it, and that's called supination. If we have pronation, we rotate the arm or the leg down or the palm of the hand down, and that's pronation. There's also dorsiflexion and plantar flexion. I always had a difficult time remembering the difference. So again, I think of certain things to try to help me remember. Dorsiflexion is going to be able to move when you're moving the foot towards the ankle. So you're pulling it up. Plantar flexion is when you're pushing the foot down. So I look at it as plantar, we're planting our foot on the gas pedal to make our car go. So if we're planting it down, that's plantar flexion. Dorsiflexion is when we're pulling the foot up. Seems silly, but it helps me remember. We have to remember muscles are named according to their origin, their insertion, their action, where they're located, the direction the fibers go, how many divisions, or the shape and size. So as we look at that, when you start to learn all those muscles for your anatomy class, they're going to be named crazy names because of all these factors. So again, we're going to run through, I'm just going to kind of walk through some of these. I'm not going to be asking you specific muscles because that is truly for your anatomy class. I am stopping here. The deltoid, again, if you're giving injections, remember when we talked about the acromion process last chapter? We identify that, go 3 fingers down, and we are at the deltoid muscle where we're going to be giving intramuscular injections. Again, the hamstrings, the quadriceps, there are so many different muscles in the body, and that is for another class. Some of the medical specialties related to the muscular system is an exercise physiology or physiologist, and they really work with patients to develop exercise programs with the physician's supervision, making sure that the patient's able to do it, that we're not overextending them. Neurologists, again, they treat specialty disorders of the nerves. And so they're going to be doing, working with our patients with paralysis and some muscular disorders. An occupational therapist or an OT works with patients to be able to do activities of daily living. So that's going to be to help them be able to button their shirt, to get their socks on. And it may sound simple, but after you've had a knee replacement, trying to reach down and get a sock on is difficult. So those occupational therapists are the ones that are working with us. So we absolutely can work through the day, the things that we normally do. They're working with us to make sure that we have function in our those activities. Physical therapists, on the other hand, help treat and prevent disability or restore function. So after a knee replacement, we would go to the physical therapist to help us build those muscles up and restore that back to the function that we once had. And sports medicine, again, they're going to be working specifically with sports teams or sports-related injuries. Different terminology that you're going to see. You're going to hear fibromyalgia. Again, if we had to define that, it's going to be pain in many the pain in the fibrous tissue and muscles. The same thing with fasciitis. It's going to be an inflammation of the fascia. Tendinitis, again, you're going to hear you need to be looking at those combining forms and learning them. So when you see these words, you can break them apart and be able to define them. So please be studying those combining forms for this chapter. Chronic fatigue syndrome, again, this unfortunately affects many body systems. We don't know what causes it, but it actually can be worsened by different physical, mental activities. It's just a really debilitating disease. There are different terms as well. Adhesions. This is when a lot of times we see adhesions when you've had surgery and they've cut through the muscle and the tissue. And what we get is fibrous tissue that's grown that actually adheres something to another structure that's not normal. So you'll hear people say you have adhesions from your scar. So maybe that tissue is being hooked on to the bowel or another structure in the abdomen, and it can be very uncomfortable. Atrophy is actually the weakness or wearing down of the tissues. And we see that after you've had a cast on, your muscles are atrophied because we haven't used them. And so usually after a patient has had a cast on, they have to build up the muscles in that body part again. Myalgia, again, is going to be a pain in the muscles, and myocele is going to be a herniation of the muscles. Different, again, looking at the way you break up, myelinosis is the destruction of the muscle. And again, sometimes that will happen through autoimmune diseases. There's certain diseases that where our muscles break down. ALS, some of those diseases out there that actually cause issues. Myorexis is actually a rupturing or tearing of the muscle. And poliomyositis is going to be an inflammation of many muscles. Again, this was a big area for the last. Pinia is a deficiency. So this is deficiency of the flesh. So if we see those terms, you need to be able to break it down. But pinia means deficiency. Rhabdomyo is a striated muscle. That's the combining form. And when we talk about muscle tone, there's 3 different terms that you may see used. Atonic, if we go back to our prefixes, A means without. So this means lacking normal muscle tone. Please notice how they have defined it, pertaining to lack of or without muscle or tone. Dystonia is going to be a condition of bad tone or impairing of voluntary muscle movement because it's not the tone of the muscle is not good. And then we have hypotonia as well, and that is a deficient condition of low muscle tone or deficient muscle tone. Ataxia is actually lack of muscle coordination during voluntary movement. And, and a contracture is actually when the elastic connective tissue gets replaced with non-elastic fibrous tissue. We see this a lot with stroke patients who aren't able to move. So if they're not able to move, a lot of times what they'll do is they'll put a ball in their hand, or they'll put a washcloth to help it from actually closing and making a tight fist. There's an intermittent claudication, and that is going to be those pains in your legs muscles that occur when we exercise, but when we rest, it was relieved by the rest. It's just that no pain, no gain statement. A spasm is just an involuntary contraction of the muscles, and myoclonus is an involuntary jerking of the muscles. Singultus is actually a spasm of the diaphragm. It's that's a medical term for a hiccup. A cramp, we know, is a painful spasm in the leg. What we have to do is get up and walk away, or walk around to try to walk it off. But if you remember at the beginning of the chapter, we talked about when one set of muscles is contracting, the other one is, relaxing. That's what happens a lot with these cramps. You've got to be able to figure out which way to move your leg to be able to relieve that cramp. Torticollis is actually a stiff neck. That's the medical term for a stiff neck. When we fall asleep in a funny position and we wake up, and that is extremely painful. Bradykinesia, again, is slow movement. Dyskinesia is impaired movement. And hyperkinesia is an increase in muscle function or activity. Myasthenia gravis is an autoimmune disease. Again, it actually causes the muscles to lose to weaken, and we have some paralysis. There are hopefully they will get there are medications, but we also hope that we can get some movement back through physical therapy. Muscular dystrophy, this is a genetic disorder. Again, there's progressive weakening and degeneration of those skeletal muscles. It does not affect the nervous system. There is really no treatment for this. There are two different forms of muscular dystrophy. There's Duchenne muscular dystrophy, affects boys from the age of 3 to 5. They may be unable to walk by the age of 12. The problem with this form, it's a severe form. They can develop breathing difficulties and heart disease as well. Becker muscular dystrophy is similar to, but much less severe than the Duchenne. Repetitive stress disorders. This happens for people that do repetitive motion on their jobs. So let me give you some examples. Dental hygienists. This is a huge issue with dental hygienists when they constantly are in there cleaning your teeth. Massage therapists have repetitive stress disorders because they use the same type of motion. And believe it or not, people that work in chicken factories, like meat processing plants, because they use the same type of motion over and over again. Massage therapy is a wonderful treatment for this. They've actually put massage therapists in meat plants, in the chicken plant, like down in Moorfield, to help them. So they're working those muscles and be able to keep them so they're not getting that repetitive stress disorder. Myofascial pain syndrome. Again, this is pain that goes throughout the body. The muscles contract repeatedly. Trigger point therapy is really, really nice for some of this. And it's actually myofascial release, where they go in, they use the trigger points in massage to try to help relieve some of that muscle and relax the muscle so they're not in such pain. Rotator cuff, again, we can have an impingement, which just means there's inflammation and swelling of the tendons. So that kind of cramps up the shoulder joint. Rotator cuff tendonitis is actually an inflammation of the tendons in the rotator cuff, and then a ruptured rotator cuff. And that's where the tendons are weak and they tear due to the lack of overuse or lack of treatment, and that has to be surgically repaired. Carpal tunnel, again, is there as a nerve that passes through the tendons down in the arm, and if there is swelling, it can cause pressure on that nerve and it causes a lot of pain or numbness and tingling. There are surgical procedures that we can actually have done that release that and make it a little bit more comfortable. Ganglion cysts, they are just fluid-filled cysts, usually on the outer side surface of the wrist. It may be from just having an injury in the same place. Most of the time they don't require treatment, but there is an old-time treatment. They used to take the Bible and you'd put your hand down and they would drop the Bible on it and it would burst the cyst and then it would be taken care of. Old-fashioned, we don't recommend it, but you may have heard your grandparents talk about that. Epicondylitis, again, inflammation of the tissue around the elbow. We also have heel spurs, and that's when you get a calcium deposit near the heel bone, and boy, is it uncomfortable. It causes a lot of pain because every time you step down, the patient can feel those spurs on that on the calcium deposit. Plantar fasciitis, again, it's an inflammation of the on the sole of the foot. It really causes a lot of foot and heel pain when you're walking or running. If you sit down for a while and stand up, it gets very, very tight. People need to walk to be able to move it. Treatment usually is physical therapy, wearing a boot, letting it relax a little bit. Sprains, strains, and shin splints. A sprain is an injury due to tearing or really pulling on a ligament. A strain is stretching and tearing a muscle or tendon. So there's a difference there. Sprain is a ligament. Strain is a muscle or tendon. And then shin splints is when the muscle tears away from the tibia, and most everybody has had the joy of having that. We can also have a hamstring injury and our Achilles tendon, any of those things that we have that we see, especially in our athletes. Different types of paralysis. There's myoparesis, which is actually a weakening or slight muscular paralysis. It's a partial. It's not complete paralysis. Hemiparalysis is when we have paralysis on just one side of the body. We see this a lot in stroke patients. And hemiplegia is a total paralysis. So the hemiparesis is a weakening or slight paralysis. The hemiplegia is a total paralysis on that one side of the body. Paraplegics are, that's a paralysis of both legs or a lower part of the body. Quadriplegia is a paralysis of all four extremities. This depends on where the break is. If you have a broken back, if we have a cervical fracture, you're going to have quadriplegia. If we have a cervical or lumbar break, you're going to see paraplegia. Again, these are the different procedures that can be done. Again, you can do tendon reflexes, you can do range of motion testings, electromyography. They're going to actually monitor the muscle with the machine. Muscle biopsy, they can go in and get a picture of it. There are medications that you can use. If you have pulled muscles, we can take antispasmodics. We can take skeletal muscle relaxants. And there's also neuromuscular blockers that can be used in extreme cases. Ergonomics is a huge piece. We need to make sure when we're sitting at a desk that our monitor is in front of us and we're sitting with a straight back, because we can get a lot of injuries. Proper ergonomics is very important in body mechanics as well. Again, we talked about this. Massage therapy works beautifully, occupational therapy, and physical therapy for all of these muscular diseases. RICE stands for rest, ice, compression, elevation. Anytime we have muscle injury, we want to ice it first before we put heat on it. It's always ice the first few days, and then we can go to heat if that's what our physical therapist tells us we need to do. Again, some terms. Fasciotomy is an incision into. Fascioplasty is a surgical repair of the fascia. So again, knowing these suffixes is very, very important to us as we learn how to define these medical terms. Okay, we're hitting the home stretch. So tenodesis is actually the suturing together the end of a tendon to a bone. Tenorrhaphy is actually going to be the surgical suturing at the divided ends of a tendon. When we talk, again, looking at the terms, breaking this down, again, surgical incision into the tendon. It's going to be very, very important for you to be able to know those combining forms. And again, my myopathy is a surgical suturing of muscles. So when you see these on your test, you need to know that raphe is a surgical suturing and myo is muscle. Teno is the tendons. So that's going to be very important. Hope this helped and good luck on your test.